Hello. Thank you for joining us for our virtual CU Anschutz Wellness Series, Happy and Healthy Hour. We're thrilled that you're taking the time to connect today with your CU Anschutz alumni community and focus on your wellness. My name is Tammy Spencer, and I'm the Assistant Dean for the undergraduate program at the University of Colorado College of Nursing. For those of you attending your first Happy and Healthy Hour, this series was developed to help provide practical tips to support your self-care as health professionals. This series had covered topics from sleep health to the positive effects of animal connections to burnout in healthcare professionals. Today, we bring our campus expertise on a topic that affects all of us: courageous clarity in setting boundaries of wellness. This evening, we will learn to identify behaviors that predispose us to fatigue and burnout while learning courageous steps in caring for self in the work environment. I now have the privilege of introducing tonight's speaker and fellow colleague at the College of Nursing, Dr. Rosario Medina. Dr. Medina is a native New Yorker, but spent 26 years in Fort Lauderdale, Florida, before transferring to Denver. She completed her Bachelor of Nursing at Pace University School of Nursing at Pleasantville, New York. In 1990, Rosario graduated from the College of New Rochelle, New York, as a clinical nurse specialist with a minor in education. She has 2 postgraduate degrees, a family nurse practitioner degree from Florida Atlantic University and an acute care nurse practitioner degree from Barry University. She achieved her PhD in nursing at Barry University in Florida in 2007. Thank you, Dr. Medina, for being with us this evening.
You're welcome. Thank you. I'm going to advance to the presentation. Welcome, everybody. The topic for this evening is courageous clarity in setting boundaries of wellness. So I just want to welcome you in. And of course, we're in an academic setting, so we always have to go over some objectives. And I'll start with the big one, right? The visionary one: to build a culture of courageous clinicians who can clearly identify and articulate boundaries for wellness. But in actuality, at the end of this presentation, we're hoping that you're going to be able to define wellness within your own context, articulate the multiple domains of wellness, identify threats to wellness, and proactively address them. We're going to also have an opportunity to translate into scenarios the steps to achieve clarity, boundaries, and wellness. Now, this presentation has been built with a major assumption, and that is that many clinicians have not identified wellness or made plans for it and are constantly confronted with crisis that further jeopardizes their state of wellness. So, disclaimer, I have received no financial support for this presentation, but I have utilized content from mainstream leaders who focus on leadership and wellness. Brene Brown is a researcher, professor at the University of Houston. Most importantly, she's a social worker and author of multiple books such as Daring Greatly, Rising Strong, Braving the Wilderness, and most recently, Dare to Lead. This is one of the writings that I have utilized many of her quotes, particularly because she focuses on vulnerability and authenticity, and I really felt that it was relevant to our topic of wellness. Rachel Butzman is author of Rethink blog and LinkedIn, and a particular blog that she wrote and spoke about was Making Complex Ideas Simple, and she's a major follower of Brene Brown and really, again, spoke about the importance of clarity. Gary Brunson is Korn Ferry CEO and blogger on leadership, and added some perspectives of how COVID has affected our wellness. And I just thought that some of those concepts were great concepts for us to review today. So a little bit about me as your speaker. I'm presently a professor at the College of Nursing. I'm the Associate Dean for Clinical and Community Affairs. And what that means is that I oversee primarily nurse-managed clinics through the College of Nursing Enterprise. We have a federally funded clinic. We have Campus Health, which has been known for student focus, but as of COVID, we have become a primary care clinic for our staff and faculty, even our nearby community. Also, we have the Bellevue Point Clinic, which is a primary care clinic in the Centennial suburb area. And most importantly, I want to add that I oversee also a variety of nurse or midwives here on campus, two which are responsible for 40% of the babies that are delivered. Most importantly, I'm a family nurse practitioner. I'm a mother, a daughter, a sister, and an advocate for the underserved. That's really what I've devoted most of my practice life. And my 38 years of a nurse have been divided, whereas the last 22 years have been focused as a family nurse practitioner. 27 of my career years have been in academia, and that has been either as faculty or as a director or administrator of multiple programs, academic programs, or now as the associate dean of the clinical practice. My education has prepared me to come into each scenario detached of my own emotions and focusing or focused on the patient, the student, or the situation. I call it scientifically detached or proficiently looking at each situation from a scientific mind. I have to share with you this evening that I am not a psychotherapist. So I'm not here to give you psychotherapy. I am qualified to take care of patients that suffer from anxiety and depression. But the concepts we're going to be speaking tonight are general concepts of wellness and some ideas that I believe will help all of us in reflecting on what wellness is. Like many of you, I'm a clinician, and our careers have much pride in the theory that perfection and high accomplishment equals excellent and prestige. And that has a lot of positive weight to it, but it has also placed a lot of burden for us as clinicians. In 2006, I started a paradigm shift. I began my journey of bringing my vulnerable self into each situation and discovering that being humanly known was a value added to each place that I existed. Now, if we had time this evening, I would get into the Watson theory and explain what that meant in terms of each scenario, but I'll leave it at saying that my humanness is something that I needed to consider instead of just being the scientist at the bedside. I am a recovering workaholic who continues to seek wellness as I lead and within the human domain. So I don't have this all together, and this presentation is also a reminder to myself in this journey that I have chosen to walk in. So let's set the scene for this evening. Over 8 months ago, I was asked to speak for this happy hour of health. And at that time, I said, what can I really focus on if we're going to talk about health? And I said, well, great, let's talk about seeking these boundaries on physical health as it relates to sleep and exercise and diet, because that's something we all need and something we all need reminders of, particularly setting up boundaries for wellness. But then COVID happened. And then social justice issues happened. And the political arena happened, and we're not going to get into that this evening. We'll review some of the COVID and social justice as it relates to wellness. But lots has happened since 8 months ago. But we're still going to concentrate on this being a happy hour. So I'm hoping that it doesn't come across as being a complete lecture. we'll share some concepts, but I would like to help you, invite you to a place where you can wind down and connect to some of the other folks that are connecting with you this evening, or who have decided to give some of their evening hours after a long day of work. That you may find this a safe place to reflect on some of the concepts that we will be reviewing this evening. And also an opportunity for a dialogue of discovery and learning as we build our new structure of wellness. As we work through the presentation, I'll let you know some opportunities that you will have to share your thoughts and ideas. And we'll even have some scenarios that you will be able to apply some of the concepts. COVID has redefined wellness for us. It has been completely disruptive to our wellness, and not just physically. It has affected financial and economical securities, because for some, they have lost jobs. It has affected the job career, because for many of those that actually remained at work, they were constantly thinking, will I still have a job next month? And the daily norm became change. Now, for those of you who like change, I think even you became a little fatigued, because change was a constant, has continued to be a constant, and we've had to become adjusted to that. Our lives, which have been compartmentalized into play, into school, into the office, into the home life, has been condensed and shrunken down. In fact, we've gone from segmentation to integration within days or weeks. We've had to rethink about our space. In fact, the new term for 2020 is social distance. And I think from the very beginning, they utilized that term and realized that it wasn't an inappropriate term. They really should have said physical distance, because social distance definitely plays a different weight on your wellness. But needless to say, rethinking space, whether you're online to get something at the grocery store, or whether you were online to finally get into the restaurant that you wanted, made things so awkward and different. Or stay in place. Just new ways of allocating times. All of a sudden, we're not out on the road, we're not commuting. If you looked at the roads, they were kind of empty. And that was great for many who say, oh, I'm so happy I didn't have to do all of that commuting. And then others who said, this is horrible. I needed that commuting time so that I can decompress after a long day of work, or so that I can prepare myself to approach the task at work. For many of us, we've had nostalgic feelings of what used to be, what was normal versus what is normal now. Realistically, what is normal now? Bernstein provides a positive perspective on this analogy, though. He says that the old way of things can be the attic in the house, the things that you look at from time to time. Not everybody goes to the attic all the time. And that the new way is found in the basement, and that we need to look at it as new possibilities, as we may bring some of the games that were in the attic down to the basement to play with family members. We have new ways of connecting. Zoom meetings have become the way of life. In fact, I've actually given it a new name. I call it Zoomitis. By the end of the day, you're completely exhausted. But I think the most creative, even most vulnerable part about Zoom meetings these days is that you have the dogs barking in the background. You have partners or spouses behind you, half clothed, or the kids that are demanding for the snacks while you're really trying to convince your audience on the presentation that you're giving. Most importantly, I think we've learned the importance of human connection and the power of vulnerability. With all of these things that have happened, one of the most powerful moments for me in staying in place, in being isolated, was putting on the TV or hearing about people coming out every day at 8 o'clock globally, starving for connection, making noise and praising the healthcare providers. It really just showed a vulnerable part of who we are as human beings. And it really helped us reflect on our own wellness at that time. We've also been bombarded with social injustice. It has given us ways to redefine wellness. Unless you've been under a hole somewhere, these topics and concepts have affected you, have disrupted your wellness. So psychologically and emotionally, you've been forced to think about things that maybe you never even thought about before, even felt about before, or are learning about what other people are feeling. Intellectually, you're having to rethink how to share that with others. And socially, being sensitive how you actually reflect on the thoughts. Environmentally, whether you were at stay at home, you were watching on TV, recognizing that our environment for many of our cities were being affected. And it affected your state of wellness. I think the most important thing for us to recognize that this new normal has given us the loss of control. That is normal. But as we build our new spaces and way of being, we are in the perfect place to evaluate wellness. What is wellness? To identify the need for new boundaries and maybe set boundaries for the first time if you have not before. Identify what is causing the frustration and fatigue, and maybe how to actively prevent it. So these last 8 months has given us a lot of food for thought, and whether you were prepared for them or not, we're at a good place to really start reflecting, where are we in terms of wellness? So the objective this evening is to define wellness and to try to seek ways to achieve it in your own personal life. So I've provided a few definitions for you. Wellness is defined differently depending on the circumstance and context, and that is so important. I just shared with you some contextual things that have been happening that has redefined wellness for us. Wellness is an active process of becoming aware of and making choices toward a healthy and fulfilling life, whatever that means to you. I like what the University of California defined wellness as. Wellness is more than being free from illness. It is a dynamic process of change and growth. Of course, as a nurse, I look at wellness within our definition, where we have always said that wellness is a balance of the psychological, the spiritual, and physical. In fact, we call it a holistic perspective that is suspended within a period of time, and most importantly, it's defined by the individual. Wellness is determined by your values. It truly is. What's wellness to you is not wellness to me. So I wanted to share with you my picture of wellness, or a small portion of wellness to me. And for those of you that are looking to the screen and saying, what is that? It's a picture of a cup of coffee. And to me, it has, it speaks to two major areas of wellness, or domains of wellness to me, of social and spiritual areas for me. I love getting up very early in the morning with a cup of coffee in quietness and reflecting about the week, the day before, the situation that I may be working through or preparing for. It just allows me time to reflect, and it's really important for me. From a spiritual perspective, it allows me to align myself and center. When I don't have those opportunities to do that, and many times I'm traveling either to present or because I belong to national organizations and I'm at another side of the US, I'm off. I find myself off-centered unless I'm spending a few days there, and I quickly look at prevention and thinking, how do I center myself? So there are many domains to wellness. We're going to go over those, but those are really important to me. And I have been able to identify them as places of importance for me to feel at optimal health. Why does wellness matter? Maintaining optimal level of wellness is crucial to living a higher quality life. And that can be while you're having an illness or while you're living with chronic disease. Wellness matters because everything we do and every emotion you feel relates to your well-being. In turn, our well-being directly affects our actions, emotions, and our physical. Most importantly, it affects the way you deal with stress. Just shared with you a few minutes ago, my ability to have that quiet time in the morning and centering my thoughts, reflecting on my social connections, my spiritual importance, centers me to deal with a variety of stressors that will hit me through the day. It is an ongoing circle that happens whether you attend to it or not. And I think that's one of the reasons that I wanted to bring this as a topic for us to really think about, because it will happen. The crisis will happen, and whether you're prepared or not, it will affect you. And for many of us as clinicians, we have found that. We know about burnout. We know about the stressors that COVID has brought to clinicians at the forefront. We have heard about awful situations through these crises. It's an ongoing circle that happens whether you attend to it or not, so let's attend to it. Optimal wellness subdues stress, reduces the risk of illness, and ensures positive interactions. That sounds great, but achieving wellness requires work. Before we go through some of those steps, I wanted to share with you some of the dimensions of wellness, and recognize that I have listed these, but many of them are intertwined to each other. I'm trying to separate them for the sake of the presentation, and during the scenarios, you'll be able to pinpoint some of these in some of the scenarios. Hopefully you will. There's emotional / psychological, is understanding your feelings and coping effectively to stress. So emotional wellness is really having some control over your feelings. Financial wellness, successfully managing your expenses. And that does not necessarily mean being well off. It means being content, that you have a plan, that you feel that you have some sort of control in your finances. Environmental speaks to the safety of our environment, or finding a respectful environment that provides you safety. Intellectual wellness allows for creative and stimulating activities to occur. Occupational wellness speaks to being satisfied by your profession, your career. There's a sense of enrichment. It doesn't become your whole life, but it adds to your life. Physical, and I'll say psychological again, because many physiological elements affect psychology, speaks to optimal health. And that's some of the components that I shared with you in the beginning: the exercise, the sleep, and the diet. Social wellness speaks to effectively and comfortably engaging with others and developing support systems on a regular basis. And then there's the spiritual, the set of values that help you seek meaning and purpose, even in the midst of your crises. So these are the dimensions of wellness, and we'll come back to these during the scenarios to see if you can actually pick these out in the scenarios. So what is wellness defined by you? If I were to ask you to close your eyes, to look at those domains that I just described for you, which one of those speaks to you? This is the opportunity that you will have to put something in the chat, and Dr. Spencer will pick up a few of these after I finish with these comments. But think about, what is wellness to you? How many dimensions of health have you actively planned? How many people around you know about your wellness desires? Have you shared it with anybody? Do you have accountability partners, people that can actually keep you on track? Dr. Spencer, have you been able to pick up a few?
I have. What I'm seeing is holistically balanced,
Okay.
financial wellness, sufficient rest, wellness is a good night's sleep, real downtime spent with husband and sons.
Good example. It's, you know, it's almost an exercise that you need to do, but it is an important exercise. And hopefully after tonight's presentation, you will go home and write these down, because for the most part, as clinicians, we don't do this. We spend most of our time taking care of others, but we don't do much of a good job taking care of ourselves. So identifying wellness requires courage. It requires you stepping to the uncomfortable, because you need to let others know what that wellness means to you, and you need to set up boundaries so that you can achieve that wellness. Somebody said a good night's sleep. Well, how do you get that good night's sleep, right? Letting others know those boundaries, like don't disturb me after such time, can be scary. It makes you vulnerable. It lets others know what can cause you to be ill. But it is important. Brene Brown states, courage is feeling afraid about something, but doing it anyways. So where are you uncomfortable about sharing with others about your wellness? At work? At home? Brene also states that clear is kind and unclear is unkind. Those two concepts resonate with me all the time. It causes me to reflect on the things that may be bothering me, or the things that maybe I didn't take the time to really recognize were part of the things that were bothering me, or that I should have spoke with someone in order to maintain the level of wellness. It takes courage having that conversation with those that are around you. Well, you need to set those expectations. Expectations come from the belief that something will happen, something you want. And it's important that you let your expectations be known before a crisis. That's always very important, by the way. For most of us as clinicians, crisis is happening all the time. So it really requires you to do a lot of pre-planning. I can speak on a personal level at home. This is an area that I've continuously have had to work on, because it's almost like you're expecting people to read your mind because they know you or live with you. But that's unfair. You need to let others know about it. When your expectations are not met, or maybe unrealistic, there are heightened levels of frustration, resentment, disappointment, lack of sleep, anger. And you do have options. You can lower your expectations and quietly be miserable, or you can clearly articulate your expectations, courageously have those conversations before the crisis, and accomplish a sense of wellness in your own life. So 5 tips in setting clear expectations. Know thyself and what you want. That's a hard one, but it is important that you spend some time. So going home and writing down, what are the things that are important? Getting a night's sleep, maybe just having some quiet time. Make a list for yourself. Value and practice your voice. Practice how you're going to share it. And most importantly, be timely. During a crisis situation is not the time to share which one of the domains are the most important, because most people don't want to hear about it at that time. They're dealing with the crisis. So it is important that you pre-plan. Never bring half-baked expectations. I had a wonderful conversation last evening with my son-in-law, who shared that a good friend of his was in the middle of a good relationship, and where he thought that maybe the next steps were possibly going to be marriage. And this young man was very clear about the fact that he was a farmer, and that he had a life in farming, and that he would see himself as the next generation living in this farmland and carrying out the business. And he shared it with this young woman and said, this is where I plan to spend the rest of my life. If you and I were to move to a more serious relationship, would you be okay with that? So that is so clear. It's not half-baked. It's no, well, not maybe I can leave the farm, or maybe. It was very clear. The intentions were very clear, but very scary. She could have said, nope, I'm not living in a farm. I'm out of here. They're happily married, by the way, and expecting their second child, but it all started with those clear expectations. I think an important factor after you've shared those expectations is to assure that you've been heard. So after you've shared what you're expecting, so that you can seek your wellness, do that reflective hearing and assure that they understand. Don't assume. So walking through the process of immediate crisis, hopefully you've already done the sharing beforehand, or maybe not, but here you are, there's an immediate crisis. It's important to identify what's being asked of you in a situation that may affect your wellness. Identify what dimensions of wellness is being affected. That's really important. So that whole chart that I gave you before, recognize which one of those are affected during that crisis or that situation, and evaluate if you had actually made expectations clear toward any of them. If no, it's a little too late during a crisis to kind of state it, but make realistic plans and clarify for the future. If yes, then bring to remembrance the expectation and negotiate, if you can, if it's not a life and death situation, and attempt to regain a sense of balance for your wellness. So reflect on how to respond to a crisis. Can you afford compromising the domain of wellness that is being affected? Who is the person behind the ask, the need, or the crisis? That person in power over you? Or are you in power over them? Are they a significant other, a partner, a friend, a colleague, a boss? Because how you respond can add more stress, but it also helps you understand who you need to have the conversations with. Not during the crisis, but later. During that time of reflection, determine the time that is required to get the ask or the need done. What are the priorities? And I think this is a really important one, because as clinicians, we most often see a crisis or a demand that is being placed on us on top of everything else. COVID has been a great example of that. More is being asked of you with less time. But for the most part, we try to do it all instead of reprioritizing, shifting priorities, and then sharing the shift with others. In other words, I am doing this, but I can't do this, and getting in contact with the individuals or the individual that will need to be known about, I can't get to this right now because I have a crisis at hand. Instead of doing everything, something has to give. Something has to give. Review for prevention after the crisis. So as I stated, we're in the crisis. During the crisis, you may not get your optimal wellness. You may not get everything that you want. Your expectations may have been broken, particularly if you didn't get to share. But when you have time to reflect, how has the crisis compromised your wellness? How could you have addressed this or will address this for the future? Many of us become so exhausted after a crisis, we get through it and forget to even plan for the future, and then a crisis happens again. So implementing a plan for prevention is important in the review. We're going to go over some scenarios, and I want to be sensitive to time. I have about 4 scenarios. We don't have to go through all 4. I know the first one will take us a little bit more time than maybe the second one or the third, depending on time. There are a series of steps, I call them questions, that I would like for you to work through in each scenario. And when we go through the first one, we'll walk through each one of these questions. Maybe if we get to the second one, we can just walk through all of them and then have a time to reflect. It'll be a time that you'll be able to put things in the chat, or if not, you will be unmuted, okay? So the steps for the scenarios are identify the ask or the need, identify which wellness domain has been affected. Can you change the impact of the ask? Is it possible? Can you prevent the effects in the future? And what would be a clear boundary to set for the future? If the crisis is happening now, and you had not had an opportunity to set the boundary before the crisis, what boundary could you set for the future? Okay, so those are steps for the scenarios that we're about to go into in a few seconds. And I'm going to move right into the first scenario. It's going to take us a little bit of time. I'll state the questions again. Scenario number 1, the email. It's Wednesday, and after a long day of meetings, you review the last email of the day. The email was sent at 3 p.m. and there is an ask for a letter of recommendation for rank and promotion, and it's due the next morning at 9 o'clock. And this comes from one of your direct reports. Now, this employee had been out on vacation and forgot about the deadline for the letter, the need of this letter. The letter will require a thorough review of the employee's performance from the previous year and a comprehensive summary or write-up. Presently, you're finalizing work on a presentation for the next faculty meeting, which is due on Monday morning, as well as helping your kids with their homework after a day of Zoom lectures, after their virtual learning. So that's the scenario. Let's ask the questions. Identify the ask or the need. And you can put this either in your chat or you can raise your hands. What do you think the ask is here? You have to be very clear about what the ask is so that then you can determine which domain you believe is being affected.
Dr. Medina, we do have one response, and I'm going to go ahead and read it, and that is to support outside of work time with a tight timeline.
Okay, right. Okay, so that the ask, this email is asking for rank and promotion letter, which is going to affect outside of work time, right? Which wellness domain do you think will be affected by this ask or this crisis?
We have another response, and that is sleep wellness.
Okay. Anything else in any of the domains that we described earlier?
Another response is emotional wellness.
Right. Any others?
Social, spending time with family is another reply.
Okay, great.
And the art of saying no.
Yeah. Although sometimes we can, and sometimes if we're right at the last minute, we can't because there's a need. But in this situation, you may be able to. In fact, that's the third question. Can you change the impact of the ask? Can you say no? It's a direct report. By not having this letter, that means that promotion will not go forward.
We had an interesting reply from someone saying that she would feel stressful or stressed and rushed, and that she feels like she wouldn't have time to handle this request, and that she feels like she could not do a good job, which would equate to poor emotional wellness.
Yes.
And then another reply is occupational and what the consequences of saying no would be.
Right, which is what I alluded to. How can you prevent this in the future?
There are a couple replies. The first is setting clear boundaries, and then clarity of expectations with direct reports, and don't accommodate it this time.
That's a courageous response, but yes, right?
We do have one more, or a couple more. You could have a template. You could have a template that assists in writing the letter and know who is ready for promotion.
Okay.
Someone else said that she would try to have a conversation with the sender when her head was cool, requesting more time and manageable schedule. Or clarify with people requesting that in future that they provide more time for this request. And then another reply was prompt staff to send requests at least a week in advance.
Excellent. Well, you addressed the last question, which is what would be clear boundaries to set for the future. And those were perfect examples, assuring that, you know, first of all, if promotion letters are going to be going out, that these are set times during the year, right? And to have that expectation be placed on you at the last minute is almost unfair. Okay, so difficult, it's a crisis, but you have to recognize how it's affecting you and think about what the ramifications are at the present time. Can it be prevented? And what would you do? How to set boundaries in the future. Let's move on to our second scenario. So you come across an email sent by one of the team members in the office committee stating he cannot make tomorrow's meeting and requests for you to finalize his portion by the next morning. Doing this will require an all-night call in order to integrate your data and present a comprehensive picture of your team's outcome. What is the ask here? And what is the domain that is being affected? Can you change the impact? How can you prevent the effects for the future? And what would be a set of boundaries, specific boundaries?
We had a reply come in that said this would be finishing someone else's work.
How would we prevent that from happening? If you're part of a committee, how could we prevent that from happening? In the future, because presently you may have to if the outcomes were expected the next day anyways.
So we've had a few replies come in, and a lot of them have to do with deadlines, setting deadlines ahead of time and making sure that those deadlines are clear, setting expectations, holding your colleagues accountable, setting deadlines further in advance, and then sleep, emotional wellness are both affected, and you need to set clear expectations for the future.
Yeah. Okay. Well, those are some excellent examples. Again, these are scenarios that we live on a day-to-day. I have two other scenarios, but I want to be sensitive to the time because we have 10 minutes till the end. I'll quickly just go over three. One more patient, like none of us have had this happen, right? They add a patient at the last minute. And what that means is that your pre-schedule date is going to be affected because you have a highly complex patient being squeezed on your schedule at the last minute. And I'll add that this is not the first time. You don't have to answer that, but I'll just want to give you what that scenario was. And the fourth one is the vacation. You made vacation request 6 months ago, and you had planned to go on a camping trip. The kids, 5, 9, and 13, very vulnerable ages, had been part of the plan and were excited to go. Your partner has taken time off. You get to your team meeting on Monday and found out that your position has been furloughed and vacations have been canceled. Some people actually went through this, through COVID. Major crisis, obviously affecting people's wellness. These are some of the realities that many of our clinicians, I know in the clinics that I introduced you to, have been exposed to. And having opportunities to share how their wellness has been affected has been very important for us. I've actually conducted some town hall meetings to discuss some of these. Well, the road in owning your wellness. How can you own yours today? As we convert new spaces and transfer our minds to actualize a new reality, now more than ever, wellness needs to be identified and protected. You need to carve it out into your existence. You need to identify it. Look into the wellness domains that we spoke about this evening. Which one speaks to you the loudest? Which area in your story of wellness do you want to change? You can't change all of them, but which one can you change and is being affected mostly now? With whom do you have to have the courageous conversation with? Identify it. Start practicing the conversation. It will be scary. It will require courage. But when you have the courage to walk into your story and own it, you get to write the ending. Be courageous and clear and set your path to wellness. It will mean a lot to you and all of the others around you as well. Thank you.
Thank you so much, Dr. Medina, for this fabulous conversation that we're having here. I just have a few questions in the Q&A that I will ask. I value your point about being clear regarding expectations with others, but that starts with having clarity yourself. If you do not have that clarity, how do you develop it or bring that clarity for yourself first?
I think it starts with the exercise like I was giving you here, looking at the domains and really allowing them to speak to you. I think as clinicians, I stated in the beginning, we do a phenomenal job diagnosing, figuring out what is not working for others and making plans with them and helping them. Well, those same concepts we can apply to ourselves and start thinking, what is it that I really need? Is it a good night's sleep? Is it changing my diet? Is it going to bed earlier? Who can I get to help me accomplish those things? Many times it requires help. It requires others to help you be accountable. And it also requires you having those courageous conversations that make you feel vulnerable because you're asking for a need.
Thank you. And we also had an ask in the chat. Could we put up the slide again about the domains, Rosario, as we're going through these questions?
Sure, let me see if I can get back to it.
And I'll go ahead and ask the next question. What is the relationship between boundaries and wellness? Does every wellness dimension need boundaries to uphold it? What else do you need?
I would say you do need the boundaries. So let's talk about diets, right? You need to have the boundary and balance, by the way. Some of us are very good at setting boundaries and being unrealistic. So as it relates to what you eat. For example, I take care of chronic patients who have diabetes, and they think that having a visit with me in the office means you can't eat anything. Instead, setting boundaries about what they can eat and recognizing that there'll be days of cheating or days that they can have off days, but trying to set boundaries for themselves at home. Don't bring the snacks home. Don't allow others to influence how you're making decisions. So I do believe boundaries is part of wellness, whether it's on diet, whether it's on social interactions. But first you have to know yourself. You have to know what wellness you're trying to achieve.
Thank you. Next question. I feel like I am receiving a message that boundaries can only be set for future crisis. What are things we can do to protect our current needs in each of these boundaries? It seems impossible to cover all future scenarios. Isn't a part of courageous vulnerability holding your ground in current tough situations?
So the scenarios that I try to give you was for the future. And one of the questions said, reflect, had you already set the boundary? And if you did, then you get to renegotiate, right? For example, you've shared that it's really important for you to have time with your family and you're taking that vacation time. And now something has happened. Well, you have an opportunity to renegotiate or reflect back and say, this is what we had spoken about, and it is really important for me and my family. And I've had those conversations real life. So the goal of this presentation is not for you to just think about the prevention of the future. The goal is that many, or the assumption as I started the presentation, is that many of us have not done it. And holding ground, it requires tact, right? Because let's say the scenario with the patient that came in at the last minute, of course we're going to take care of the patient. But it's going to require us to have conversations for the future so that we can think about scheduling. We can think about who should be contacted before a patient gets on the schedule. At that present time, you may not be able to say no. You may not. And hopefully you've made boundaries in other areas of wellness that will allow you to handle that situation.
Thank you. Another question. In my current organizational culture, I feel like a lone warrior in being courageous about boundaries to protect wellness. How do you handle the mental stress and fear that emerges when you feel like you're the only one doing this?
Yes. So I started the presentation with that as well. If you happen to be a clinician, our profession prides itself on being martyr. I'm doing more. I'm squeezing more into your time. You need to make decisions. Is the place that you're working, do you think you'll be able to make small changes through time, or will that cause you more stress? And rethinking, will another place be a place to be? There is nothing wrong with that. I have shared with faculty when I was overseeing the academic side, finding your happy place doesn't mean you're in utopia, but it means that you find a balance for most of your dimensions. And if you can't achieve that, there may be that day you may have to make that decision. Is this where I want to be? Because you are important enough to make that decision. And that's a courageous decision to have to make too.
Thank you. And we have a hand raised from Sandra. Sandra, would you like to ask your question?
Can we hear her? Because I can't.
Sorry, I must have accidentally pushed the button.
No worries.
Sorry.
All right. So I think unless there's any other questions, we'll wrap up our time here this evening to be mindful of everybody else's time, and so you can get on with your evening and hopefully capturing some well-deserved time for your own wellness. Thank you again for everybody for your time this evening. I hope you'll be able to join us for the next event in the series on November 18th, featuring Dr. Edna Ma, Shark Tank and Survivor contestant, speak on leaning into challenges and embracing opportunity. During this presentation, you will learn how losing on Survivor and Shark Tank grew Dr. Ma's resilience, and learn about steps you can take to lean into challenges and grow your confidence. Don't forget to connect with us on Instagram to check out stories about your fellow alumni, or at our newly launched CU Anschutz Alumni LinkedIn group focused on professional development. Thank you so much for tuning in and all you do as healthcare professionals for your campus and your community. Have a great evening.